Integrative craniosacral balances therapy techniques to address chronic pain without uncomfortable settling between sessions. Let's start with some therapy concepts. Direct and indirect techniques explore why we choose a particular direction of treatment and how we think about that. This applies throughout the body, but let's look at a vertebra for a second. The vertebra that is highlighted is to the left. If we test its mobility, it moves more easily to the left than to the right. Direct technique is often called structural technique because it sees the structure as out of place to the left. The practitioner moves it back into place and fixes the problem of alignment. Indirect technique is often called functional technique because it considers the vertebra to be behaving badly. Typically, the practitioner slowly and lightly exaggerates the imbalance. After a period, the vertebra has a palpable shift. When the practitioner lets go, the body corrects the problematic behavior. Okay, now let's look at how those techniques influence the body. Structural techniques change the shape and length of things. They tend to produce a body that's enduring in its stability, recovery, and is better at self-correcting. Functional work changes behaviors. It offers relief and makes you feel good when you get off the table. After functional correction, we see that the vertebra is back in place. It has a more balanced range of motion. This happens typically with either indirect technique or with some light, quick, direct technique. Structural correction typically comes from light, sustained, direct technique. It lengthens connective tissues that give the joint more possibilities. The structures around this read that, and we have an enduring change in the joint. Craniosacral structures have more complicated relationships. A single technique usually involves many joints and connective tissues. Structural work produces enduring improvements, but it needs to be followed by functional balancing to avoid an uncomfortable settling period. The integrative model recognizes that craniostructural techniques create shifts throughout the body. As chronic conditions are healed, improvements in strength, flexibility, and the ability to self-correct continue for months. This is Tony Preston. You can reach me at integrativeworks@gmail.com.